Welcome back, everybody, to the Service and Sacrifice on WTEN Plus. I'm Ryan Peterson. We do thank you for joining us on this Friday, May the 22nd. Now, we have a special guest this week, not just for our middle couple segments, but the entire show, because Dom is off this week, and he's not on vacation, which he has been a couple of times, running off and chasing that sunshine. He's doing some training here locally at the VA, from what I understand. Right, gentlemen? William May, Outreach Coordinator for the Stratton VA Hospital here in Albany, joins us, along with Emil Baker, as always. Gentlemen, hello. Thanks for coming in, Will.
Thank you.
Welcome to us, because we love being here with you.
Oh, that's very sweet of you. Yeah, Dom said that, so I guess there's some actual training, some stuff going on at the VA itself, so he didn't actually have to go out of town, but unable to join us this morning.
He's in treatment for his crayon addiction.
Here it comes.
He's a Marine.
Okay.
That's common.
All right. I don't know. I haven't tried them. I hear they're pretty good. Little salt, little pepper. Makes everything better, right? How's everybody doing? As we're getting closer to summer here, it's still unfortunately kind of damp and cool and raw outside, but
Totally inconsistent, and I find it invigorating some mornings, and miserable some mornings.
Typical New York weather.
Yeah.
Will, so let's talk a little bit about your job as Outreach Coordinator, the Stratton VA. What exactly are you doing?
I go out to local events like VFWs, American Legions. I go to the veteran service officers in each county. We try to have veteran-specific, events. Mm-hmm. And my primary focus is to enroll these veterans in VA healthcare.
You know, and you were mentioning earlier before we started rolling here, and it's something Emil and I talk about a lot, and that's getting them to enroll, period, sometimes is difficult. And why is that? What do you hear when you're out there?
I think there's a misconception that they don't really need the services. I think it should go to somebody that needs it, which is the total opposite. For every new enrollment, we get monies that cover the following veterans coming behind them. And they shouldn't wait until, they're in a hospital, right, or, it's too late. So every veteran, just try to enroll.
And Emma, that's a common refrain, right? Especially amongst the Vietnam generation. They think they don't need it. Somebody else is better off having those services, and it's just the wrong way to think.
Right. They utilize it. They actually help other vets because the VA gets set funds based on head count, and that helps everyone. And they don't really understand the fact that even if they get a disability and a rating, that's money that's going to help their families, that's going to help them. And quite honestly, if they took it and donated it, it's still not hurting any funding that comes in. These people wait. I think Vietnam vets sometimes are considered a little bit stubborn. I waited 40 years before I ever signed up or set foot in the VA, and that was pretty common, and there's still a lot that haven't. But the important thing is they have to understand that the benefits for a disabled veteran can also benefit their families.
Right.
And it's important that they look at the whole picture to understand it. And as I said, it's a plus for every single veteran that uses the VA hospital. More funding will come in if somebody signs up. And you can't wait until you're too old to understand what's going on, because then your family's drawn into the picture. So make it easy on your family, make it easy on yourself, and act now.
And Will, do you think part of it, too, is maybe they're concerned about the difficulty of actually enrolling and the steps you have to take? I mean, there are people like you and tons of people at the VA that make that enrollment process really easy.
Yeah, I think there's a misconception that it's difficult and they got to jump through hoops, but really, I go to people's houses, their employment, wherever, to get them enrolled, and I make it as easy as possible.
And coming up in just a few minutes as we get into the main two segments of the program here, we'll be talking about that enrollment process and these priority groups, right? And Will's going to fill us in on all of that. You yourself, Will, are a veteran. When did you serve?
Yeah, right after high school, I joined the Army National Guard, did that for a year, and then I liked it. So then I decided to join the Navy, where I did 6.
And where were you deployed during that time?
I did a lot of Westpacks. I was stationed in San Diego, California. I liked it.
We thank you for your service. When did you join the VA? How long have you been with the VA here in Albany?
Since 2014.
And you come right in as an outreach coordinator, or did you start
No.
somewhere else in the
It
middle?
was an entry-level position. I started in community care when that first started coming about, and then just worked my way up.
And what's it been like for you working with your fellow veterans?
I like it.
Yeah.
I mean, it's a rewarding career. You know, you get to really help out veterans that are in need.
Mm-hmm.
You know, they're appreciative. I can't say anything bad about it.
And you get to, spend your time with guys like this guy right here.
Yep.
Yeah, I want to say the best conversations I've ever had were in the waiting rooms, waiting for an appointment, and seeing another Vietnam vet. You start a conversation, you find so much commonality, and it's warming to be with those folks.
That's the biggest thing when you get out of the military. You miss that camaraderie,
Sure.
the joking. It's fun. I like it.
And reach out and find it through places like the VA and elsewhere. All right, when we come back, we're going to talk a little bit more about enrollment, how important it is, and the idea behind these priority groups, and Will's going to map that all out for us. You're watching Service and Sacrifice here on WTEN Plus. We're back after a quick break. Welcome back to Service and Sacrifice here on this Friday, May the 22nd. Joined by Will May today, Outreach Coordinator from the Stratton VA Medical Center, sitting in for Dom. Hey, Emil.
He's deserved a little break. He's recuperating from his crayons.
He's been working. He's been working hard. Stop with the crayons. All right. So we're talking about this week mainly what are known as priority groups, Will, when it comes to getting enrolled in VA healthcare, correct?
Correct.
All right. So there, from what I've seen here on this email so nicely sent to me by Dom about a week ago, there are 8 priority groups. And priority 1, of course, is the highest priority, correct? And what does that entail? And we'll kind of start to break down some of these here.
So like the priority groups are all based on service connection, your disability rating, and your income and military history. So like you mentioned, priority group 1, those are 50 to 100% service-connected veterans, unemployable due to service connections, or Medal of Honor recipients.
So when we say priority, when they come in to get enrolled, if you fall within that, you kind of get to the front of the line, correct? Is that what we mean here?
Correct.
Yeah. And priority 2, what does priority 2 entail?
Those are rated 30 to or 40% service connected.
And as I look here down the priority 3, now we're getting into former prisoners of war, Purple Heart recipients, and again, the service-connected disability percentage drops as we get into the higher priority round.
Yeah, that group's 10 to 20%.
Just out of curiosity, if you are a Purple Heart recipient or a former POW, I'm curious as to why they wouldn't be in a priority 1 or priority 2, simply because of that, or is it just because? Do we know why that is? I'm just
that's just like the basic cutoff.
Yeah.
But usually, if you're a Purple Heart recipient, you're going to be most likely 100% service connected.
Gotcha. And as we move on here down the line, let's just roll right into priority group 4. This covers veterans who are what?
They receive aid and attendance, housebound, basically the 3 M's, military, medical, and money. And they require assistance of another person for their daily living activities.
When we talk about getting bumped to the front of the line with these groups when it comes time to enroll, what exactly does that mean? If you're like priority 1, when you come in to enroll, if there's somebody of another priority there, do you get, how does that work as far as like getting?
Yeah, everybody that enrolls, it's just a basic math formula that we put in the numbers, their service connections, their income, and then it'll tell us what priority group they're in.
Perfect. Priority group 5. I see some here served in World War II, Persian Gulf. Anybody that may have been stationed at Camp Lejeune. Does that have to do with the water issues that they had there for a long time? Yeah.
Yes. Yep.
My brother-in-law is stationed there right now, actually, with my sister and my nephew.
Nice.
He's the commanding officer of the 110 there. He's a big artillery guy.
Okay.
They shoot the big guns.
Yeah.
And then, of course, priority group 6, 7, and 8.
These are usually the 0% service-connected veterans, Agent Orange, combat veterans. 7 is below the geographic income limits and agrees to pay copays. And the last one is Group 8. They have the higher income, they're not service-connected, and they agree to copays.
And for anybody that's watching and listening to all this, I know we've had some more dynamic topics here on the show, but this is important. And when we're talking about getting people enrolled, and it may sound like a lot, but when they come in and say, hey, look, I should have done this earlier, I'm ready to do it now, how easy is it to get the ball rolling?
Oh, it's like a 10, 15-minute process from start to finish. It's, if they need service connections, we always refer them to, the veteran service officers, state, local. We try to get the whole package for them instead of just, nickel and diming.
Right. And Emma, what do you have to say to anybody out there, fellow veterans of your generation or even younger, the guys that may have been serving in the global war on terror, and they are not enrolled yet?
One of the important things I think in this is
waiting for, right?
Yeah, the important thing is that you act as a salesperson. You become informative. You talk to them. I was actually sent to the VA, like I said, it was now 15 years ago, by my own private doctor because I had type 2 diabetes. And he said, were you ever in the service? Were you ever in Vietnam? And I said, yeah. And he said, you have to go to the VA. He said, they just approved it as a presumptive that type 2, if you're in Vietnam, you're exposed to Agent Orange. I had no clue, and my private doctor sent it to me, sent me there. So that's what I urge everybody to do is if you know another Vietnam veteran or their family members, you talk to them, you enlighten them and say this is what you need to do, and it's not hard. And, offer to maybe even help a company. What you're doing and training people and educating them is amazing.
All right, we're going to take another quick break. When we come back, a little bit more on these groups and, again, the importance of enrollment and how to go about it. You're watching Service and Sacrifice here on WTEN Plus. Back after this. All right, welcome back to Service and Sacrifice on this Friday, May 22nd, talking all things enrollment. Do it if you're not enrolled, if you're a veteran out there, if you're caring for a veteran and they are not enrolled in VA healthcare, get it done. Because, Will, you've talked about visiting veterans. You will go to their house if that's what it takes, right, to get them enrolled. And we don't want it to be too late. Why?
Well, I mean, just for example, I met a Vietnam veteran that was currently in a hospital. He was registered, but he wasn't enrolled, and he needed a referral to go out into a long-term nursing care home. But without a primary doctor, without being service-connected, now we're behind the 8 ball trying to get that going.
So when we talk about service-connected and this disability rating, is that something that requires them to visit the doctor in order to get that rating?
No, they could just meet with a VSO. They can file, VSO will get their medical records, file for whatever service connection that he feels he's getting, and then they just go see we have 2 comp and pen doctors, which is unique for Albany compared to the other visits. They can do it right there.
And when you talk about VSO, Veteran Service Officer, Are they local to the VA, or are they also available through like a county's veteran service agency?
Yeah, up on our 6th floor at the VA, we have VSOs. There's New York State, VFWs, American Legion are up there. And then each county has a VSO, and they take care of the local county.
And how important, too, are those county veteran service agencies in helping our veterans get enrolled? They can really walk them through all this, too, and help get them connected to you, right?
Yes, they're very important.
Emil, when you talk to those VSOs out there in the community, what are you hearing from them?
They're hearing that there's quite a few older Vietnam veterans that haven't approached anything, and they didn't even understand that they don't have to do anything but sign their name to the form. The VSO does everything. So it's just going, listening to the explanation, and then letting the VSO do all the work for you. Mm-hmm. It's an easy process, but people have put it off for so long, they're reluctant. They think, oh, it's terrible. And the VA pops up on my email every once in a while, asking me to put an app on my phone, which I don't do because I don't do apps. And I just want it, a conversation. I'll deal with online. I'll go to a website. That's as far as I'm going to go with it. And I think a lot of older vets don't want to have to think any of this through. Just sign their name and get the information they need.
And, I've started to learn a little bit of the terminology and things since we started this program. DD 214, that's a form that proves your service, correct? Yes. When you served, your actual dates of service. Yes. Now, is that something that is required for enrollment?
Yes.
Yeah.
If they don't have a copy, then I can usually get a copy.
And where do they have to go? Where do you get a copy of that for them? Who is that obtained through?
There's a program that we have is VBMS that usually has all their medical records, their DD 214. If not, then we send a request to St. Louis and get it that way.
All right. So again, if you're watching and you're listening to this, there are two guys here that are telling you how easy it is. Take advantage of it. And Emma, what are some of the things, the advantages for a veteran's family if they're enrolled through healthcare too?
Well, the important thing as you get older is that the things that you can't do yourself, you need to have those done for you. And in the past, families have done that, hopefully, for the veteran. But this allows you to rely on some alternate sources. The VA has home health care programs in different situations. And you're also invited to go to some of these facilities and day trips and do things that aren't that complex if you have somebody that's trained and knowledgeable. So it's important that veteran understand what they're eligible for, what will benefit and help them. And again, their medication's all going to be paid for in most cases. Someone coming to assist them in their living will be a complimentary, no charge. And that makes them able to stay in their home. And like he said, he had someone that was looking to live in a veteran home. We've got those around New York State, too, downstate and out west. Yeah. And, it's certainly great to be in a home like that with other veterans.
And we can't stress enough, too, Will, and we talk about it a lot, the quality of the care that is available right here in Albany through the Stratton VA Medical Center. I mean, we've done stories on the cutting-edge equipment that's come in for cancer patients, and that level of care is really second to none, is it not?
Oh, it is. I mean, I'm not just saying it because I work there.
Yeah.
But, I get my care there. And, if you go to the emergency room, not to go to Albany Med, you're going to be there for, hours. You come to our emergency room, pretty much within a half hour, you're being seen.
Mm-hmm. That's good to know. And getting that enrolled in that VA healthcare too, Emma, what else does it get you? Those commissaries, right?
Oh, there's
saving a ton on your groceries and everything else.
Tons of different things that you can apply for in there. And if you receive a disability rating, you can have your home taxes reduced too. So lots of things that are a result of you being certified as this veteran in standing with service with disabilities, tons of benefits that come up. And people don't even know about these things, not a clue. And this is all part of the education process.
And hopefully we're making that well known here through Service and Sacrifice. Hey, we're going to take another quick break, but we're coming up awfully quick on Memorial Day. We're going to talk a little bit about that when we come back right after this quick break. Welcome back to Service and Sacrifice one last time this week. So, Monday is Memorial Day. Lots of stuff happens all around the Capital Region. One of the big ones, Emily, you reminded me, you sent me a nice little picture here, coming up at Saratoga National Cemetery, starting at 11 in the morning. There's a big ceremony up there.
Yes, and for those that aren't aware of it, that's up in a town called Stillwater in Saratoga County. And it's one of the nicest national cemeteries I've come across. It's large, it's very large, and it's well kept with a combination of volunteers and VA Stratton sponsored employees. But it has beautiful grounds for the plots, the cemetery plots. In some instances, family members can also be buried there, spouses, and it's all encompassing. There's something there that makes you feel like you're part of everybody. And the people that are buried there are just us veterans that are a little bit older, and we understand that's the next step for us too. It's a treatment of us and a remembrance of us that honors us, and that's a wonderful feeling when you get up there.
And so much history up that way too. I mean, it's right near the Saratoga National Battlefield.
Yep.
Lots of celebrations coming up this summer for the 250th anniversary of this country. So much to take advantage of. Will, do you know of any plans that the Stratton VA has coming up this summer in regards to 250 and everything else?
No, I know we're doing the march on Memorial Day.
Mm-hmm.
And then I'm sure there's going to be a bunch of activities that I'll be going to.
Yeah. So just keep an eye out and take advantage. I'm sure we'll be talking much more about things that as they arise here in this program from week to week. Before we close things out here on this May 22nd, Emma, what does it mean to you knowing that this country was founded 250 years ago and you were a big part of keeping the freedoms alive that we all enjoy here?
It makes me feel that we are a part of a very large and an older organization. And it changes, and there's things that we may like that we don't like in the changes, but there's still the basic strategy and the basic reason that it exists. And that means freedom for people and protecting people. And the military does that, and this is a day where people say thank you for what you did. But understanding that the organization of the government has to sustain, has to play fair and interact and keep advancing it, to make it go.
Sorry, I didn't mean to cut you off, but I would pose the same question to you as well.
Oh, I think it's important. I mean, America wouldn't be where it is without the veterans. And, they deserve all the accolades that they get.
I look at whenever I roll the animation for the open of our show, and we see the flags there, and reminds me of when you visit one of the national cemeteries, especially up in Saratoga, and you see all the flags that have been placed on the graves, or you visit in the wintertime when all the wreaths are placed on the graves as well. It's a beautiful sight. It's a humbling sight. And so the event that's coming up on Monday up at the cemetery is open to the public. And if you've never been, I would encourage you, if you have the time and you're available, to go up and witness that. It's certainly worth seeing, isn't it?
Yes.
And just a note is the flags and the wreaths, they're done by volunteers, other veterans and their families, and it's just everybody thinks it's important, so everybody helps.
Yep.
So as we head into this Memorial Day weekend, again, we remember, we thank, and honor that respect to a veteran in your life. If you haven't, shake their hand, give them a hug, say thank you, and encourage them to get enrolled if they're not, right?
Absolutely.
There we go. All right, that's going to do it for this week here on Service and Sacrifice. Will, thanks so much for coming in, sitting in for Dom. We appreciate it. Emil, nice to see you as always.
Thank you.
And remember, if you're not on WTN Plus, if you're watching us, thank you. But if you're not, remind people, you find us through Apple TV, Amazon Fire, or Roku. Go to the store on either one of those platforms. You download WTN Plus. You get all our newscasts here at News 10 Plus, all this original exclusive programming that we produce, and you'll also catch us on our YouTube page as well. We'll see you back here next week on Service and Sacrifice on WTN Plus.